Hello, I hope everybody can hear me. Just let me check. Yeah, I should be talking now. Um, I should be talking now. I've had some issues in webinars in the past where I have left my the mute button on, so hopefully you can all hear me. If not, send a tell me on the Q&A. Welcome everybody. I've started this a couple of minutes early just to let everybody else trickle in. We've got lots of people here already, but there's still more to come, so I'm guessing they'll be coming in the next few minutes. So you can admire the beard that I'm growing here while we're waiting. Welcome. For those that don't know me, my name is Alan Freestone, and I'm a homeopath. Hopefully you know what that means. I'm not here to give you a lecture on homeopathy. I'm here today to talk about my approach to PANDAS symptoms. So I'm guessing that's why you've all signed up. So I know some of my existing patients have signed up today, and there might even be some homeopaths that have signed up, hoping to get some of my insights. But really, this isn't for them. This webinar today is aimed at parents of people with PANDAS, PANS, or suspected condition like that, to learn more about what homeopathy can do for their kids. So how did I get here? So I specialize in treating kids with autism, and that's not all my you know what I'm going to do. I'm going to turn on the chat function, in case you guys need to tell me anything. So the chat is on the right hand side of your screen, so you can type things if there's technical difficulties or things aren't working. So yeah, I specialize in treating autism using homeopathy, and I've treated a lot of cases now. It's approaching about 600 cases of autism, and homeopathy can really help with autism. But what I was finding right at the beginning, there was people that, and I was seeing these families, and they were saying, "Do you treat PANDAS too?" And this was maybe 3 years ago or something. And I had to confess, and I said, I have no idea what that is. I'd never heard of it. So I had to go away and have a Google. And then I decided, I know, I'm going to run a little trial. So basically, I asked families to sign up for a free trial, and about 34 families, I think, took me up on that offer. And my plan at that time was, so as I say, this was probably 3 years ago, and my plan at that time was, maybe it was 4 years ago, was to see if I could work out a protocol to follow using homeopathy that could help with PANDAS symptoms. So we did that. I spoke to them all, sent out the remedies, and we had a really good feedback. We had some really amazing results. But I had to conclude that there wasn't anything I couldn't sort of say and put on my website. If you've got PANDAS, take this homeopathic remedy. It'll work in 50% of cases. Unfortunately, I couldn't conclude that. What I could conclude was that PANDAS tends to respond very well to homeopathy. What was interesting to me when I took those cases was that about half of the people that were coming with these PANDAS symptoms were also on the autistic spectrum. And yeah, I'm not saying all PANDAS kids are autistic, but there seemed to be a definite link between the two conditions, which I thought was very interesting. So I'm going to stick my neck out here and say I approach autism as if I'm treating a toxic state, and that is very often really effective. So I had a Skype call this morning before I've started this, and there's strong evidence in that case that there's the fertility drugs that the mother took before actually during the pregnancy, because she was still taking fertility drugs and didn't realize she was pregnant. There's strong evidence that doing a detox of those drugs is going to improve the kids' symptoms. So why does there seem to be such a strong crossover between the autism group and the PANDAS group? And I think the reason comes down to, well, possibly toxicity, but I think the reason comes down to something is deranging the immune system in these PANDAS kids. Strep by itself shouldn't be dangerous or harmful to a well-functioning immune system. We have strep inside us, along with lots and lots of other bacteria and things, and our bodies cope with it very well, and it's probably an important part of the microbiome, as they call it. So why is it that some kids, these PANDAS kids, why is it that their immune system is not able to cope with strep as well as the rest of the population? So that's why I think there's a big crossover between the PANDAS kids and the autism kids, because often it's kind of similar causes. It's like something has deranged the immune system. Now the strep, rather than being the baddie, the strep is merely a opportunistic infection. So you can see this by so say your kid wakes up one morning and they're scared to leave the house, and they start exhibiting all these PANDAS symptoms, OCD symptoms, etc. You take them to your enlightened doctor, who actually accepts that there is such a thing as PANDAS. You do blood work. He's got a strep infection. He has antibiotics, and it fixes the OCD stuff overnight. Then 3 months later, the same thing happens again. More antibiotics. Then three months after that, he's in school. Somebody in the class is sick. The next minute, he's got his symptoms back. That's not an immune system that's functioning properly. Something has gone wrong. So I think it's superficial to say, oh yeah, you treat PANDAS using antibiotics. You can treat the acute symptoms of PANDAS using antibiotics, but you haven't removed the underlying susceptibility. Why is that child more susceptible to getting these symptoms than other people in his class? That's the interesting question, and that's why I think homeopathy can be so useful for these cases. So there's PANDAS and there's PANDAS, as I'm sure you're aware. It's this umbrella term. The symptoms, it can mean all sorts of different things for different people, and in fact, some cases, well, you can the strep titers measure high, but antibiotics don't work. In other cases, there's no strep that they can detect, and the antibiotics don't work. And then other cases, there is clearly strep there, and the antibiotics work temporarily, but then the symptoms come back. So there are clearly different flavors of PANDAS. And I was taking notes here for this talk today to discuss how a homeopath would approach a PANDAS case, and maybe you can sort of have a look and think, and go, okay, yes, that makes sense. That could be the reason our child has got the PANDAS. So the first thing I do with any case, PANDAS, autism, or whatever, is build a timeline of that child's life. And it can often, and I know there's other people that work in healthcare, and they talk about timelines, but I think homeopaths seem to go. We really go to town on these things. We like lots of detail, but so often, maybe 9 times out of 10, doing the timeline allows the parents to see possible connections from things to things that they didn't notice before. Um, so the first thing that I would do, the first time that somebody comes to see me, we build a timeline of the child. So we're assuming it's a PANDAS child here. So of the child's life uh, from preconception right up to today. So say this is using an example of a sort of a nice clean um, um, timeline here, because in the real world it's often a little bit messy. So we had a natural conception, we had lovely pregnancy, we had a lovely labour, we had no problems at all meeting the milestones and all the rest of it. And then at age 5, the child suddenly wakes up with crazy obsessive compulsive symptoms. They're not able to go to school anymore. They're spitting. They're really aggressive towards their mum. Just total craziness, like a switch. The obvious thing that I would be asking in that case is, well, what was happening around that time? And I see it over and over again where um, something happens, like, I don't know, the child, there was a case last week, and the child had a flu vaccine, and then very short time later, PANDAS symptoms started occurring. Now we can, and then they've gone through the medical approach, and they have been given antibiotics, and it sort of worked, but then it comes back again, and they've gone back to the doctor and sort of worked, and now the doctor's talking about psychiatric medicines to control them, to suppress the behaviours, which is obviously a really bad thing to be giving to a child. Is have a look at the research. There is none, is the short answer. Um, they have seen that psychiatric medicines can help. What would you say? Control some symptoms that these kids have, but there's no research on the safety of these things. There's no telling what that's doing to brain development or just physical development, or whether it's going to lead to problems later in life, whether that's mental or physical, hormonal, or we really don't know. So yeah, so the family have gone down that route. They've started antibiotics. It's helped, and it stops, as the normal thing with PANDAS. And now the doctor's suggesting maybe they need some psychiatric medicines. So they come to me. We do this timeline, and I see that, okay, everything looks lovely, but there was a flu vaccine, and then the PANDAS symptoms started. Now I'm not saying there's a definite link, but there's a possibility that that's one of the factors here. So what we could do in that case is treat the flu vaccine, detox the flu vaccine, and then see what happens. And if the flu vaccine was, in that particular case, if that was the thing that deranged the immune system, that unbalanced the immune system, that then allowed the streptococcal to proliferate too much, then we're going to see an improvement in that immune system and a less susceptibility for that child getting the PANDAS and the symptoms going away. If it wasn't the flu vaccine in that case, then nothing. Then that won't happen. But we can. So that's my way, I suppose, of saying we can do this timeline. We can come up with a nice possible cause and effect, and then we can test that hypothesis and see whether it's true or not. If it's true and we detox that, then we'll fix that. I've just spilled half my cup of tea over my sheet of paper. I'm too animated. Yeah, so that brings me on nicely to talking about. Okay, Christopher Jenkins is saying his screen is freezing. that it's not working. Is anyone else having that problem, or is that just him? Could somebody just type in their chat if you can see me talking okay? I'll pause for a second. I'll have my tea without spilling any more of it, hopefully. Nobody's replying to me. I'm going to assume that, oh, there we go, not mine. So Pauline, so it's working fine. It's fine. Right, great. Thank you. Thank you. So I'll carry on. So that brings me nicely onto the various approaches that I can take, or other excuse me, or other homeopaths can take when we're talking about when we're fixing pandas. Okay, thank you. I've got lots of people saying it's fine. Lovely. So in that case, I did the timeline, and there seemed to be a clear cause and effect. It was a flu vaccine, so we can detox that flu vaccine, and if we're right, then we'll get results. So that's one approach that you can use with homeopathy. What's wonderful about homeopathy is we can use it like a toolbox almost. So there are lots of different approaches to homeopathy, and I see one of my jobs is the first thing one of the first things that I'm doing when I am treating someone for the first time is figuring out what is the most appropriate tool to use for this, and it varies obviously. Philippe, thank you. Philippe Chancellor has asked a question. Can you ask that again later, please, Philippe? I'm going to open the Q&A box once I've bored everybody with my talking, and I'll try and answer all those questions. But right now, I just want to get through the theory before I address specific questions about cases. Okay. Okay. Yeah, one of the first things that I want to be doing is figuring out the right tool to use for that particular case, and it varies between cases. So that protocol that I mentioned earlier when I treated those 34 people in that original trial that I did way back when, I was using a few different techniques for that. It was a sort of rough and ready way of me prescribing quickly to a lot of people, so it wasn't as individualized as it would be if you just came and saw me as a individual person. So in some cases the person responded beautifully. So that tool for that person fitted them perfectly. In other cases, same tool, same remedies, did nothing at all to them. As I say, one of the first things that we need to figure out is what's the right tools for the job. So I think the conventional doctors at the minute, the ones that are even admitting there is such a thing as pandas, they're kind of stuck because they're kind of limited by the tools they have. So what do they have? They have the antibiotics. If that doesn't work, they can swap around and try different strains, or they can try combinations or whatever. Beyond that, they can start using steroids, and you're getting into the realm of using steroids to suppress an immune system. That's not a good idea. Long term, it's not healing, is it? It's suppressing symptoms. It's not very good. They're very limited because they don't have many tools in their box, and I feel very lucky because us homeopaths have loads of them. There was a case recently. Oh, I think I put it on my. You'll find it on my website, which is just my name .com, alanfreestone.com. And I called the blog post something really silly like "Cow Trumps Panda," and it amused me just because in that particular case, I had used a remedy that was made from a rotten steak. It was basically a piece of steak, so a bit of a cow, that had been left out in the sun for 2 weeks and had gone putrid and disgusting and then they turned it into a homeopathic remedy. This was back in the 19th century, and they call it pyrogen, and they found it really, really useful for dealing with bacterial infection. So I used that bit of a cow to treat the pandas, and we had amazing results with it. So in that case, it was that was a really lovely remedy. It was right for that case. But what I was getting at, that's one of the tools I've got. So back in the 19th century, believe it or not, over half of the doctors in America were homeopaths. And there's a whole big, you can follow the whole big conspiracy story of how the American Medical Association managed to stop that. And by sort of the early 20th century, there was only a few homeopaths left. They had effectively been outlawed because they were affecting pharmaceutical companies' profits even then. But what I was saying is, so that was 19th century. Homeopaths were extremely successful dealing with infection, all sorts of infections, and they built up a large repertoire for dealing with infections, whether it's bacterial or viral, whatever it happens to be. And we used these really well. And then the 1940s came along, antibiotics came into widespread use, and they were a miracle, and they fixed everything, or most things. But now, 50 years later, we're seeing, 60 years later, we're seeing that the antibiotics are losing their effectiveness. The bacteria are evolving, and they're becoming immune to it. So I'm delving back into these old books that the homeopaths were writing in the 19th century, and I'm sort of relearning and reusing a lot of the remedies that they were using to treat infections right back when, before antibiotics. And I think these remedies are going to become more and more important, not just for pandas, but in general, as antibiotics stop their effectiveness. So in some cases, they can be really, really useful tools to use. That pyrogen, I will be experimenting a lot more with that in the future. That's a way of using homeopathy that's quite what's the word? It's quite close to how a doctor would use antibiotics, I suppose, where you're saying, aha, there's a bacterial infection. I'm giving this remedy because it's good for fighting that. But there are other cases. I had a case recently, and I can't go into too much detail, of course, it's confidentiality, but I took the case and I did not believe this was actually strep. So it was diagnosed as PANDAS by the doctors. She had all the classic PANDAS symptoms, if there is such a thing. She had a group of PANDAS symptoms, shall we say? But when we took the case, there was big emotional trauma happening in the home, and a short time later, she started exhibiting these PANDAS symptoms. So in that case, if you give something that was good for treating, and she had tried antibiotics and they'd done nothing, but in that case, if I had given a homeopathic treatment using things that were good for infection, I suspect nothing at all would have happened. So instead, what I went and did was I treated there's groups of homeopathic remedies that can deal with emotional traumas, and we have all sorts of tools. And she's responding beautifully to that, and she's improving. So, kind of, it's convenient to sort of put an umbrella and say, okay, these cases with these symptoms are PANDAS, but actually it depends on the cause. And in that case, you could have given antibacterial stuff until the cows come home. It wouldn't have made any difference. The cause was emotional trauma, so you needed to fix that. So I'm not saying homeopathy is the only thing, but it would have taken homeopathy or counselling or some other thing to deal with that, rather than a drug. There's another branch of homeopathy, and this is I don't want to get into homeopathic theory because I'll just take up all the time and bore you all and use buzzwords that nobody understands. But there was a um, there was an observation, 200 years ago when they were formulating the principles of homeopathy that we still use today. You could go 200 years ago and bring a homeopath back, and they would be prescribing the same remedies for the same symptoms as I would today. There's consistency there. Um, but they noticed that there was that people came to them with problems. They gave them the correct homeopathic remedy. The person got better, and they went away. But then 6 months later, they came back with the same problem, and they would. This didn't make sense to them because the whole principle it was based on was like cures like. I've given you. You come to me with eczema that's red and inflamed and it's worse than heat, whatever. I give you sulfur. That's like cures like. That's the remedy, the right remedy for that eczema. That should have treated it. It helped. It treated it temporarily, but then it came back. So homeopaths came up with realized there was this thing, this susceptibility that was there in the background that could be that can keep causing you to fall ill in a particular way, depending on your susceptibility. Some people it might be skin stuff, other people it's lung stuff, other people it's PANDAS type symptoms that keep coming back. So there are a group of homeopathic remedies called it's called miasm theory. But there's a group of homeopathic remedies that actually can address um, um, this susceptibility. And sometimes it's inherited weakness. Sometimes we don't know why, but there's a susceptibility there, and you can keep giving the antibiotics, and it keeps. So say there's no toxicity there that we can see. There's no emotional trauma. There's nothing else. But there's a bit of evidence in the family line that there's susceptibility to certain illnesses, and that you can keep giving the homeopathic remedy like Paragen or something, or the antibiotic, and it keeps coming back. In that case, the useful thing to go and do would be to give a remedy like to address the underlying weakness. So I've given you a few different tools there that I use, but in the real world, often I'll be using multiple tools at the same time. So we might be giving the remedy to address the susceptibility once a week, maybe on the Saturday, and then maybe at the same time you're giving the Paragen, which is basically the antibacterial one, every day to try and dampen down the streptococcal bacteria. So you're going two approaches at the same time, and hopefully that is more effective than just giving one of them. There's another branch of homeopathy where you can give the bug. So you can give a homeopathic remedy made from streptococcal bacteria. It's totally safe, non-toxic. There's no strep in it. There's no strep in it left. It's gone through the manufacturing process and the homeopathic pharmacy. It's totally safe to use. So sometimes that's a useful thing to do. So it's almost like, in some cases, it's almost like the child's body has the immune system has been untuned, whatever you say, unbalanced. It's lost the ability to recognize that the strep is actually a problem. So what you can do is you can give a remedy made from the strep, and it kind of reminds the immune system. It sort of says to the immune system, hey, it's like a wanted poster, like in the Wild West they had wanted posters, dead or alive. It's a bit like that. It's a bit like there's a wanted poster goes in and it says, hey, this thing is harmful for you. You need to sort it out, and the body relearns that I need to get that strep under control. So sometimes that can be a really nice approach. Other times it does absolutely nothing. So that's one of the reasons why often I'll be doing several approaches at the same time, using several tools at the same time, because I want to hit at least something, figure out which path is right for that child, and then run with it. Okay, what I'm going to do is I'm going to close the chat and open the Q&A box. So when I've opened that, it means you can type in any questions that you would like me to answer, and I can address them over there, and I can take them one at a time. Okay, I've closed the chat and I've enabled the Q&A. I've done webinars before, but I don't think I've ever used the Q&A box, so I'm hoping it's going to work nicely. If not, we'll just use the chat box. Okay, I've sent it. I'm just having a quick look at my notes here to make sure there's nothing glaring that I've forgotten to ask. Okay, so here we go. First one: if you take multiple remedies at a time, how do you know which one they may have a negative reaction from? So good point. So usually you know is the short answer. So say we do two remedies at the same time. What I would often do is you would give one remedy on certain days of the week and another remedy on other days of the week, and then we get the parents to monitor, and then we can have a checkup with me and say, okay, yeah, on the Sunday he's really awful, he's terrible, he's awful, and I'll say, okay, right, stop the Saturday remedy, continue with the Tuesday Thursday remedy. Let's swap the Saturday remedy for something else. But it sounds like it would be a mush and confusing, but because I know the expected reactions to particular remedies, I can usually tell which, if a symptom comes up and you think, oh, which one was it? Usually I can tell because, well, that's clearly a lachesis symptom, so clearly it's the lachesis causing that, not the whatever else. Hopefully I've answered that correctly. Second one is, how do you know when the event, okay, so how do you know when the toxin, I think, so this is from Pamela, how do you know when the toxin, i.e. the vaccine or the ultrasound remedy is working? So going back to my example about the flu, so I was saying it was a nice timeline, there was no obvious traumas, there was no obvious illnesses or whatever else, but then the child had the flu vaccine, and then immediately after they started with PANDAS symptoms. Okay, so in that case, what I might do is give them a vaccine, a flu vaccine detox. And this is a very common way that I work whenever I'm working with autistic kids, but sometimes I use it with PANDAS cases as well. So a typical detox, I use the same protocol almost always, and it's an 8-week block. And again, just like I was saying that the homeopathic pharmacies have remedies made from the bugs themselves. So in Panda's case, it could be strep. So they've actually made a remedy from the strep bacteria. And just the same way, they have made remedies from all these toxins. So there will be a remedy made from that exact batch of flu vaccine. So what I would do in that case is prescribe the detox, and it would be 4 bottles of that flu vaccine in homeopathic form, of course. And the child would take it for 8 weeks, and you would give 2 pills every week. So you would give so the strength, I don't know who's familiar with the strengths of homeopathic remedies, but there's a 30C, there's a 200C, there's a 1M, and there's a 10M that I typically use. Just sort of think of it as different strengths of the remedy. And so for 2 weeks you would give the 30, 2 weeks you would give the 200, then the 1M, then the 10M, and the and the parents would monitor progress. Okay, so I don't have time to go into this in a lot of detail, but I'll just quickly tell you guys this. So there's 3 possible outcomes to a detox. The first one is that the child will react in some way to it, and it depends on the person, but typically it could be a slight fever, or loose bowels, or a skin rash, or increased urination, or increased sweating, or sometimes just agitated. Sometimes they are just under the weather and not. You just know they're sort of fighting something. And this isn't for the whole 8 weeks. This would maybe be for 2 or 3 or 4 or 5 days during the 8 weeks. So that's when you know. So that person is reacting to that detox. So that's their body telling us, yep, I've got a problem with this thing, whatever it happens to be, the flu vaccine or the ultrasounds or the IVF drugs or whatever it happens to be. And if it's right, if we've got it right, you'll get that detox, and by the end of the 8 weeks, there'll be clear signs that the child is healthier than they were before. So in the case of the flu vaccine thing, if that had caused the child to start being susceptible and getting these PANDAS symptoms, by the end of the 8 weeks, you should see the PANDAS symptoms have tailed off, and then we check up again in a couple of months' time, and there's been no recurrence of the PANDAS symptoms, because by detoxing that flu vaccine, we have removed that child's susceptibility to getting it. Okay, or it could do nothing at all. The child does not respond in any way to it, and that would probably be it. Their body telling me that wasn't it. There's something else. Something else has caused the PANDAS symptoms, not the flu vaccine. So and that happens, of course, but we have to go with the most likely cause. And I have seen flu vaccines in particular causing sort of OCD type symptoms. So yeah. Okay, hopefully I've answered that correctly. Next. When deciding on remedies, do you work backwards or forwards on the timeline? Would you treat a birth trauma before a vaccine trauma that may have occurred at age 5? So I think what Deborah is alluding to here is that the type of homeopathy where you detox things, it's commonly called cease therapy, and I've done that course. I've got the I've got the certificate for what it's worth, and I use a lot of the principles of cease when I'm practicing, but it's just one of the tools in the box. It's not the whole thing. I can't give you a clear answer. So cease typically would work backwards on the timeline. So the most recent possible toxin that the child was exposed to, you would remove that before you go to the next one, and then the next one, and then the next one. I wouldn't necessarily work like that. If a child had a flu vaccine and then ended up with PANDAS symptoms, and then 2 years later we still have the PANDAS symptoms, and then 2 years later they have I don't know, they have to go to a hospital and have an operation, and they have general anesthetic or something like that, and then they come and see me, probably I would go straight for the flu vaccine. Whereas I think somebody else, another cease therapist, might start with the anesthetic and gradually work back. It's just been my experience that you want to go for the cause. If you can find the cause of something, the thing that started everything off, that's usually where the action is. That's usually where you're going to get the fastest result. Do you use muscle testing as part of your assessment? No. That's quick. I'm not deriding muscle testing. I think sometimes people have had it's been useful for people, but I don't use it. I guess I'm I don't know. I was going to say pure. Is that the right word? I think that homeopathy has the tools within it to help. I don't feel the need. Maybe I'll change in the future, but I don't feel the need to have other supplementary things being added into the mix, like muscle testing. Do you treat sorry, next one, hopefully that answered your question. Next one, do you treat the parents to, like the mother or siblings who have the same strep issues? Yeah, so often when somebody brings a child to me, I'll be giving remedies to other members of the family. So there's a case, there's a family that I'm thinking of in particular, and they actually sail around the world. They're on a catamaran somewhere in the world as we speak, because the both children react to strep and get sick and end up with PANDAS when they're around other family members or friends that are carrying, that are sort of strep carriers but don't have any symptoms themselves. So the only way that the parents figured out how to stop that was take to the sea and stay away from people, and it works. It works, but obviously it's not a long-term solution. So yes, if clearly somebody in the family is, or we suspect somebody in the family is sort of harboring is the what's the word, typhoid Mary of the family, then yeah, we would treat that too, because there's a thing and there's a principle in homeopathy. I said I wasn't going to talk about too much, but I end up having to explain these things. There's a principle in homeopathy called maintaining cause. So really simply, if you had your hand in the fire and it's burning, the fire is a maintaining cause. Step one, take your hand out of the fire. Then you can start treating the burn. So in just the same way, if there's a maintaining cause, if there's sometimes even an emotional, like a family dynamic that's really difficult, like a abusive person in the family or something like that, that's a maintaining cause that will stop us being able to fix things until we address that. Or somebody else in the family that's harboring that's a strep carrier, but and it's just continually reinfecting the child with the susceptibility to the pandas, then they would have to be treated too. So yeah, hopefully that's answered that question. Okay, next. My kids are on antibiotics. Can they stay on them while doing the homeopathy to keep them stable? Yeah, that's a good question, and the answer is yes. So I've encountered this a lot, and if you go to some homeopaths, they will insist you stop all medicines and all supplements and everything else, and just do homeopathy. I'm realistic. You just can't do that with a lot of these kids. They, they, they can be, their symptoms can be controlled while they're on the antibiotics. As soon as you take them off, all hell breaks loose. You just can't do it. So yes is the short answer. So in that case, in a case where the kid has to stay on antibiotics, what I would tend to do is give several remedies at the same time to control the symptoms. So I would just look at, so it would be quite superficial, a bit like the antibiotics, just holding the symptom back. I would just be looking for remedies like that to hold the symptoms back, and the parents would come back, and hopefully the remedies would have. They can clearly see that the remedies are working. Then we could begin to withdraw the antibiotics, still prove that the remedies are doing the same job as the antibiotics, and they're holding the symptoms in check. And then when we have established that, then we can go deeper. We can go backwards and go, okay, let's work on the susceptibility, or let's detox, or let's do something else. But it's not appropriate to do any of those things until we're holding the symptoms in check and we've stopped the antibiotics. So the short answer is yes. The longer answer is I have to take a slightly different approach when they're on antibiotics. Have you got a remedy for metal toxicity? Mercury, arsenic, and lead. Yes is the short answer. The longer answer is, as I said before, any detox, there'll be a homeopathic remedy for it. So if you want to detox lead from the system, excuse me, I'm just going to take a drink of water here. If you want to detox lead from your system, the detox is, there's a couple of different ones, but the one I would use would be, you give them lead. You give them lead using that 8-week protocol that I talked about. So you give a homeopathic remedy made from lead at these different strengths. If you took that remedy to a chemist lab and got them to analyze it, there's no lead in it. You're not introducing more lead into their system. It's like the energy signature of lead. So it's like information. That's what's in the remedy. So what the remedy is actually doing is telling the system, you've got a problem with this toxin. You need to deal with this. So when you see that detox happening, I talked about the possible reactions. When you see that detox happening, that's the body doing that. It's not the homeopathic remedy. The homeopathic remedy, all it did was give the body some information that it needed to say, go and sort the lead out. So yes, and Yes, I'll just say yes. You can. There's remedies for it. Okay, is PANDAS exclusively a childhood disease? Can adults have it as well? Yes, the adults can have it, but by definition, pediatric is the P. So by definition, it's a childhood illness. But but really, it's just an umbrella term for a selection of symptoms. It's not a thing. It's not like tuberculosis where you can take a blood sample and you can say, yeah, we can count the bacteria there. You've got TB. PANDAS is syndrome. So of course, so there's not a PANDAS remedy, as I hope you can realize that from this talk I've been doing, that it's based on the case. So if an adult has this, has, I don't know, so like OCD stuff, violent rages, I don't know, salivating, spitting, and they've been diagnosed as something like PANDAS or PANS or whatever, well, we just go back to the timeline, don't we? And we have a look. What caused this? Is this emotional trauma? Is this toxicity? Is this what is it that precipitated this? So the label that you put on it, PANDAS, PANS, whatever, OCD, whatever other thing they come up with, that really makes no difference. What I'm interested in is why, and sometimes we don't know why, and then we can use homeopathic remedies just based on the symptoms that the person is exhibiting, like violence and spitting that I was talking about earlier. That might be a remedy called listen, which is made from the saliva of a of a rabid dog. We've got some crazy remedies in homeopathy, and that can be really useful for cases like that. I use it a lot. So sometimes you just don't know why, but the symptoms, the extreme symptoms the person's exhibiting, the homeopath will just go, they need listen, even though we don't know that if there was something that has caused them to need that. Okay. Why is your approach better than Hellkunst, or are they similar? I didn't claim I was better than Hellkunst. I'm not. I'm not. I know of Hellkunst, and I know there's some similarities, but I am no expert on Hellkunst, so I couldn't contrast the two methods. All I can say is the methods I use work well, and perhaps the Hellkunst works well as well. I don't know. Okay, well, this is a big long one. Wait a minute. This is from Hazel. Let me have a quick read of this, Hazel, and then I'll get to you. Our almost 4-year-old daughter suddenly developed head tics on Thursday. Lots of research. I've read about PANDAS. As a child, I had strong twitches, shoulder shrugs, squinting, and many habits. Sort of OCD habits she's talking about. It was very noticeable. Childhood wasn't easy and traumatic in other ways. Okay, so the GP advised her mum that she would go out of it. So this is the Hazel that we're talking about. Symptoms have reduced a lot. Okay, sorry, Hazel, I'm just skipping through this. Can you treat adults for PANDAS too? Yes. So Hazel, hopefully you can see from what I was saying earlier, the timeline is often the key here, and if you do your timeline and you have a look at the traumas and the things that you were exposed to when you were a child, and then that and there seems to be a correlation between that and your symptoms, then we could say, okay, well, if we treated those traumas, then that should improve your symptoms. So it's almost the same as doing a detox. So somebody's got high lead levels, you detox the lead, their symptoms get better. In just the same way, somebody can have an emotional trauma that they have held on to for years and years and years and years and years. There are homeopathic remedies for emotional traumas. If you give that and your body's able to let go of that trauma, then the symptoms should go away. So it's quite similar to detoxing, really. So I sort of think of it like a soldier on a battlefield, and he gets scared. which is a natural response. It's the correct response in that situation. The problem would be that maybe 10 years later he's in the supermarket and he still is scared and fight or flight. So it would be called, post-traumatic stress disorder. But really, what's happened is he had a correct, an appropriate emotional response then, but it's become stuck, and he's still got that emotional response 10 years later when he's gone down to the shop to buy a pint of milk. It's no longer appropriate. Yeah. So sort of that your body's holding on to something it doesn't need to. In just the same way, it can do that with childhood traumas. Okay, hopefully I answered that question. The short answer is yes, you can treat adults with PANDAS symptoms too. Okay, how long does a child have to be off antibiotics before they start homeopathy? So hopefully I answered that earlier, Christopher. They don't have to be off antibiotics. If if the antibiotics are needed to keep a lid on the symptoms, then we can do it in parallel at the start, and then hopefully we can gradually stop the antibiotics and hopefully maintain the symptoms, but they don't need to be off them. Do children typically regress before getting better on each remedy? Good question. I'm getting some great questions here. It depends on the type of remedy we're giving here. So in the case in the case study that I used, that I have on my website, the cow trumps pandas case, I'm getting slightly embarrassed by the name now, but there we are, it's out there. In that case, you would not expect any regression or anything like that. That's you should just expect that starts controlling the bacterial infection. That's it. You just see improvements. With the detox, which I'm guessing that's if we were going the detox route, and would you get a regression before getting better on each remedy? Sometimes you can get a reaction to it. Yes, temporarily. Before the person gets better. Yes, but it's not like I don't know, somebody's got goes into violent rages and tantrums or whatever. It's not like if you did the detox that they're going to have 10 times more violent rages. It could be something totally different. It could be a physical thing like they're just pooping 3 times a day for a few days. That could be the reaction. So it's not wouldn't necessarily be that it would cause the PANDAS symptoms to get worse. Which remedies do you use for the MMR vaccine? So same as I said before, the homeopathic pharmacies have remedies made from all these toxins. So there is a homeopathic remedy made from the various versions of MMR vaccine that are out there. There's only a few. So yeah, so you use MMR. We're positive for Lyme disease. Do you treat that? Yes is the short answer. Lyme disease is a funny one. It seems to be very, what's the word? It's a very common diagnosis now. And I'm not sure if that's just because it's fashionable at the minute, or I don't mean to be, I'm not meaning to be rude about when I say that, but I don't know if it's just the fashion at the minute and everybody's got that, or whether it is actually a real epidemic that's happening and is only now sort of becoming recognized, or some combination of those two. But it's back to susceptibility again. You can get very confused trying to treat all these different little bugs individually. I think it comes down to susceptibility again. You can be bitten by a tick that's carrying the Borrelia. I'm trying to remember the name of bacteria. That's carrying the Borrelia bacteria. If you're not susceptible to that, nothing's going to happen to you. So it all comes back to susceptibility. If you've got a good immune system, you're not going to have Lyme. If you've got co-infections like Lyme and PANDAS and whatever else, sometimes you have to take a step back and say, okay, well, what's causing me to be susceptible to all these things? So rather than trying to treat 10 different things, treat the susceptibility. So yes, I do treat it, but I might have a different approach than you're thinking. Okay, next. What if you give a strep remedy and the kid has a reaction just like strep panda reaction? Uh, Good question, Pamela. So occasionally that would happen. It's rare actually, but sometimes that would happen. If that's the case, just stop giving the remedy. So with me, I have a if somebody comes to see me, they can book like a 15-minute update in between appointments if they need to, just to discuss things like that. So say you give a few doses of the strep remedy, caused a caused increase in the panda symptoms. You would talk to me. I would just say, right, stop it, just stop it, and it all settles down very quickly. So a remedy like that doesn't stay in your system very long. It'll settle down quickly when you withdraw it. So occasionally that happens. You get a little temporary blip, and we say, okay, right, that's not the appropriate approach for that person, and we take a different tack. Okay, next, how long do you need to treat pandas? It's a difficult one, that, because there are so many possible causes for pandas, and there can be other things going on. So if the person's autistic and epileptic and is on anti-epilepsy drugs and also has pandas and also all these things going on, then it'll be long and drawn out, and you have to pick the pieces, unpick the pieces as you go. In other cases, it can be very, very rapid. So there's some cases where I've given one treatment, fixed, and hasn't come back, and then in other cases it's an ongoing uh, approach. So I'm sorry, I'm being wishy-washy there, but it just varies so much between cases. Uh, okay, this is Teresa. Okay, during the treatment, is it more common to stop a treatment when symptoms disappear, or like antibiotics where you have to finish the bottle? Uh, yeah, if you gave if I prescribed you a month's protocol, a month's prescription, and you started it, and after the first week, um, all the symptoms just stopped. Probably I would tell you, yeah, stop then. So I'm flexible, and you have to just go with the body and how the body's reacting to these things. So it might be you stop and that's it, or it might be you stop and then, I don't know, 3 weeks later, the symptoms start creeping back again, and then we might say, okay, right, restart and see if we can get ahead. So hopefully that's addressed that. Can my kids stay on herbs and supplements for immune support while treating with homeopathy? Yes, is the short answer. The slightly longer answer is I don't mind supplements that people are on, and often it can be really useful. If somebody's really uh, low in particular mineral or vitamin, um, I think supplementing that alongside homeopathy would be more effective than just giving the homeopathy to somebody that's very deficient in a mineral or vitamin. My only caveat is that I wouldn't want you starting something, a new supplement or something, in the middle of a prescription, just because I want to know what's doing what. So if you suddenly changed 3 or 4 variables and you come back after the prescription, it becomes difficult or impossible for me to know what's done what. Have my remedies worked? So that's the only thing. It's more like an admin thing that's a problem, rather than there's going to be any dangerous interactions here. Does wearing a Q-link pendant interfere or affect the homeopathy? No. It's a short answer. Is no problem. Uh, do you treat kids with Lyme, parasites, and other infections along with pandas? Yes. So I think I answered that earlier. And yes, there has been successful Lyme. Yeah, it's just another thing. I'd like to use homeopathy to detox metal, but I'm still breastfeeding a 3-year-old. Do I need to wait until she weans? Yes, you do. Because if you're detoxing a metal, um, what would you say? A physical thing has to happen here. If you've got metal inside your tissues, it has to be released into your bloodstream, get into your organs of elimination, and be removed. You've no way around that. So if you're breastfeeding, you're going to end up. Some of the metal's going to get through. So yeah, don't do it when you're breastfeeding. I recently discovered in my child has pandas. Can he be cured, or will he need to deal with it for the rest of his childhood life? Yeah, we can fix this. That's a short answer, and I'm not saying just me. I'm sure there's lots of other people that can do a similar thing, but there's no. I was in Dublin 2 years ago, I think now, at a pandas conference, and they had all the big uh, biomedical doctors there that treat pandas, Dr. Tripoletti and a few other ones, and I was astounded by the state of the art is prophylactic antibiotics until the age of 21. If that doesn't work, steroids. That's it. That's all they've got. And I thought, wow, okay, my competition aren't very good. I think I can do better than that. So yes, you shouldn't be expecting to deal with it for the rest of a childhood. Yeah, it's a fixable thing, but not with a magic bullet. There's usually a process that has to occur. I'm just conscious of the time here, but I'm going to try and get through all the questions. Would you treat symptoms that appeared since pandas appeared, but have since disappeared, or only the current symptoms? Generally, only the current symptoms. Yeah, that's the short answer. I kind of say that homeopaths have and other natural health people would say that I'm back into discussing theory again. I do apologize, but they would say that our bodies are intelligent self-healing things usually. So any symptom that a body has is it attempting to rebalance itself, and it might not be able to, but it's the symptoms it's got at the minute are giving us the hints, giving us the clues to tell us what remedies the body's going to need to get back into that balance. So old symptoms, the body's dealt with whatever it is, or it's moved on to something else. So you just look at the new symptoms. Okay. Do you treat a child with anorexia as the anorexia as a type of OCD, or is this a separate condition in itself? So, Lee, back to this timeline thing again. We want to figure out why is that child exhibiting that behavior? But yeah, it's totally treatable. Yeah. Is there any short-term remedies for pandas flare? Yes. I didn't want to give. There's a group of acute remedies you can use for pandas, but I just didn't want to give them out because I think sometimes people can do. I was going to say more harm than good. That's not true. That you can't do harm with them, but without a background in homeopathy, I'm not sure it's particularly. It would be particularly useful for you to try and use them. But yeah, short-term remedies for pandas flare. I would often, so say we're doing something, say we think it's trauma in the past, so we might give a trauma remedy every Saturday. I'm just using this as an example prescription. You might give a trauma remedy on the Saturday, but then you would give short-term acute remedies during the week to hold the acute panda symptoms. So that would be a typical way that I would work. Yeah. Is it helpful for clients to start writing out their timeline before they consult with me? It can do. Sometimes it can help to jog your memory, but we build a timeline together in the first appointment. So, but sometimes it can be worth doing because you can come to revelations yourself. You can think, oh wow, I never thought of that. But of course, it was after that all this started. It's after we got the new cat or something that all this stuff started happening. Can you treat absent seizures in children? Yes, I've treated quite a lot of that. Okay, here's one from. I'll not give somebody's name out just in case it's. We started giving our son strep pyogenes on our own, and his symptoms of pandas are almost gone. Fabulous, brilliant. So the strep pyogenes, however you pronounce it, that's the homeopathic remedy, actually made from the strep bacteria itself. Okay. However, is this just treating the symptoms rather than susceptibility? Will the symptoms likely come back? It worked, who cares? So sometimes I have experienced this where you give the strep and that takes away all the symptoms. And for some reason, that is enough that brings the body back into balance, and that is enough, and the body maintains balance after that, and they don't need anything else. They've coped with it. And in other cases, you give the strep and it helps, but then after a while it starts, the symptoms start creeping back again. So there's still an underlying thing there that needs to be addressed. But certainly there's no harm in doing that. You've not done anything wrong. You're not gonna cause any problems. You're not gonna suppress anything. You're not gonna do anything. So good. That's really good. Okay, last question here, because I'm conscious of the time. This one is: my son has a low IgG and low WBCs. Will homeopathy help with that? Yes, is the short answer. Yeah. So it makes sense that many of these kids are going to have low IgG. Their immune system is not functioning properly. That's why they've got PANDAS symptoms. It's just cause and effect. Yeah. So often in the course of treatment, you might not even be looking at you're not giving a remedy specifically to improve IgG, but you go back and you do a blood test 6 months later, and oh yeah, they're in normal range now because of the various remedies you've done. And it might have been addressing a trauma, it might have been just giving a remedy for the PANDAS symptoms, it might have been addressing some susceptibility from the family, but all these different approaches, but the result is you can measure that the IgG has returned to normal. Okay, last one. There's just one more question. If you have a reaction to a remedy like a headache, fever, or etc., and you take a drug like Motrin, does it suppress the healing? Possibly, yes. It's a wishy-washy answer, I'm sure. I'm sorry. I would prefer you did not do that because it can suppress the healing. I have some patients, and they are the bane of my life because we do a detox. We get a lovely detox response. The mum panics, and then they're the next time we speak, they've been to the doctor and they have antibiotics and steroids and all the rest of it, and nothing's happened because as soon as there was a reaction, something started happening. Boom! It gets stamped on, gets suppressed. Yeah, but for very occasional use, I don't know if I sent somebody off for an 8-week detox and you had to give one dose of Motrin in the middle, then there's probably not suppression. So there's a lot of myths around homeopathy, and a lot of people are very scared, and they think you can antidote, or you can stop it working, or you can suppress, or you give the wrong remedy and you make things worse. It's none of that stuff is true. It's robust, it's safe, and it's robust, and it works well, and it can work well alongside other things. Okay. My time is up, otherwise I'm going to end up talking for another hour. I hope everybody got out of this what I'm about, how homeopathy can help with PANDAS. Hopefully they've... oh, there's an ice cream van going past. Hopefully you can see that there's an effective alternative to just suffering with the symptoms or with the antibiotics treatments. There's things that homeopathy can do. So yeah, I would love some feedback, or if you want to drop me a line, just go to my website, alanfreestone.com, or my email is alan.homeopath@gmail.com. But I'm sure you can find me. I'm around Facebook, so I'm sure you can find me if you need to. All right, thank you everybody. I'm going off to a music festival now this weekend, so I'm hoping it's going to stay dry. Right, goodbye. Thank you.